My name is Bill Chappell. I have a question posed from the Newark Water Group. After Superstorm Sandy, the Passaic Valley Sewage Commission plant dumped several billion gallons of untreated and partially treated sewage into Newark Bay. What should Newark do to prepare for climate change, and where will the money come from? I'll sit down with my rescue inhaler now. I'm a senior citizen.
Okay. We need to answer the question.
Well, the climate change I spoke about earlier affects the stormwater drain off, and every opportunity that like for example, all of the snow when it melts is going to create debris and carry all that stuff down into the sewers and other places, and sometimes into the water, into the lake, into the river that contaminates it. And then we also pay in Newark to make sure that the water is treated, so it costs us more money every time we have non-permeable surfaces in the city. That's number one. Number two, Passaic Valley Sewage Company is notorious. We need to meter the pipe that we have to make sure that we are actually getting billed the amount of money we actually owe them, because they are robbing us on that end at the same time. But secondly, we need to sit down with Passaic Valley Sewage Company and with organizations like the Newark Water Group and other community organizations and city officials to begin talking about a strategy around things that affect the amount of water that's coming through the sewage, and for what you just talked about in terms of these kind of events that takes place in our city that are happening more and more frequently and more often.
Thank you very much. Mr. Jeffries.
I think it's simple. I think we have to hold Passaic Valley accountable for what they've done in our community. So if they've dumped pollutants into our community, if they've dumped water into our community, they need to be held accountable for that, and they need to clean it up. And so it's not only meeting with them to see if they do it, but if they don't, it's pursuing every option that's available to us, including legal options, to force them to clean up what they've done. Part of the problem we've had in the city of Newark for a long period of time is anybody can do anything. You want to sell drugs on our corners, go ahead and do it. You want to dump pollutants into our neighborhood, go ahead and do it. You want to have brownfields all over the place, you want to dump garbage in our communities, go ahead and do it. We have to have a leadership and a mayor who's going to enforce our norms, enforce our culture, so that we can set a different sort of signal, that we don't tolerate it here. People feel they can come here and do whatever it is that they want, and so we have to have the mayors going to be very aggressive around enforcement. So whether it's Passaic Valley, whether it's someone on the corners, whether it's these big developers who are causing additional pollutants, whether it's the port not policing people and holding people accountable for the pollutants in our air, we're going to hold everybody accountable so we have a safe and healthy environment.
Thank you. Question over here. You okay there? Okay, go ahead.
Good evening. My name is Carolyn Sperlin. I'm here with the National Urban League, and I'm one of the district leaders for West Ward District 17. My question is, the new healthcare legislation has created opportunities for many people and have access to healthcare. Traditional and non-traditional organizations are getting involved with disseminating information to access residents. What steps will you take to ensure that all residents get access to critical information regarding health care so that they can get the health care services that are available for them?
Under my administration, the city will partner. The federal government has spent millions of dollars on outreach under the Affordable Care Act. So what we would do as an administration is make sure we're partnering with our colleagues at the federal government so that we are identifying those places in our community that are most in need from a public health standpoint. Those residents in our community who don't have access to health care disproportionately, who don't have access to wellness. So we'll want to steer and partner with our colleagues at the federal government so that people are going into the right areas. Sometimes the feds will engage in conduct and they'll just send people where they want based upon their own determinations. So under my administration, we have a close partnership where we're sending people to our communities that need these services and resources, because these are great resources that can help our residents in a variety of different areas. There's drug treatment services available for those who may have an addiction. There's obviously basic health care services that may be available. There's wellness services available so people can get free information about eating choices and nutrition. There's even opportunities to access additional exercise services as well. So there's great resources under the Affordable Care Act, but if people don't know about it, they're not going to be able to receive the better services that they're entitled to. We'll work very closely to make sure our residents get those services.
And obviously, affordable care enables us to deal with asthma and other pollution-related illnesses. We have a question over here. Oh, you didn't answer your question? Oh, I'm sorry. I didn't mean to cut you off.
Well, so we need to do what they did in Cleveland, right? So we began to change the model from this kind of emergency care system to preventative care system. What they began to do was train organizations like you talked about, community activists to go into communities and do healthcare assessments of neighborhoods and then provide like the kind of preliminary health surveys of individuals and then attach them to clinics that were available, places that they go to and get the kind of healthcare treatment that they need. That also means that we have to expand the federally qualified healthcare centers. We have to talk to Jewish Renaissance. We have to talk to Beth Israel about expanding more healthcare institutions or facilities or clinics in neighborhoods and communities where people are. Send community activists and community people into those neighborhoods.